We'll get started in 1 minute.
Hello?
Hello.
Everybody hear me okay?
Loud and clear.
Hot damn.
Okay, everyone. I'm going to get this started here. We're going to get this out. Hold on 1 second as we get going on our broadcast on Channel 2. All right, ladies and gentlemen, welcome to our 2:15 briefing. And we will have a statement from, we'll start with Mayor Brown. We'll also have as I'm looking at our screen here, information from Altru and Dr. Deere. And we also have joining us here, School Superintendent Terry Brenner. Thank you for joining us here, Terry. Again, to the media, use the raise hand feature, and I will be able to call on you when you have questions after we get through the statements. We will then also, same thing with those participating, Dr. Brown, Mr. Phelan, Dr. Deere, Dr. Brenner, boy, lots of doctors here, and Deb Swanson here. I will control your audio. So if a question gets directed to you, I will let you know when your audio is ready to go, and you can go from there. So we'll get things going from there. So let's get started here. We'll start with Mr. Brown. Go ahead, Doctor, and you can lead the way.
Thank you. Well, good afternoon, everyone, and thank you for watching. Information is our best weapon, and I appreciate everyone staying informed. First and foremost, I'd like to express my profound gratitude to our healthcare professionals who are on the front lines during this pandemic. As of this time, there are no confirmed cases of COVID-19 in Grand Forks County, but we know that could change at any moment. Our thoughts are with you, and we will continue our part to support you moving forward. This will be a marathon, not a sprint. Now is the time to be vigilant and cautious. We will get through this. We have proven our resilience time and time again. This too shall pass, and Grand Forks will emerge stronger, together, and united. We all have a role to play in these extraordinary times, and that role is to keep our friends, neighbors, and loved ones healthy. That means we need to maintain our social distancing. That's a new term to us. Here's what it means, just to be clear. Wash your hands frequently. Stay 6 feet from others, limit visitors, and stay home. Even if you don't feel sick or have symptoms, stay home as much as possible. If you don't feel like it, you can save lives by watching Netflix on your couch. We do this for each other, and it's our responsibility. Stay home and save lives. It's that simple. It's important to keep ourselves socially connected and physically active while social distancing. Call a friend, write a letter, video conference with colleagues and loved ones. Go for a walk or a run, and exercise at home if possible. My heart goes out to all the business owners and their employees as they transition their business models and the tough decisions they've had to make this past week. There'll be a series of business listening sessions taking place this week. I look forward to listening, and thank you to our community and business leaders and partners for setting this up. These discussions are the first step in the effort to find actionable solutions in response to the hardships businesses are facing in these difficult times. To that end, these sessions will help inform us as we begin to develop a longer-term economic and social sustainability plan for our community. I call on all citizens to support the business community because in the good times and bad, they support us. They are the ones that sponsor events, sponsor our youth sports teams, donate to fundraisers, and volunteer in the community. They need us now, and it's our duty to answer the call. You can support them through ordering delivery, takeout, and curbside pickup services when possible. Every day we have the opportunity to support a local business, and I encourage all residents of Grand Forks to do so. We continue to execute our mission to protect and serve. I could not be prouder of all the work city staff has done in transitioning to remote working and ensuring the continuity of city operations. We in the Grand Forks community are blessed to have such dedicated and experienced staff to lead us through these challenging times. We've been working around the clock to ensure a continuity of operations for essential functions like public safety, public works, and waterworks. Execution of the flood action plan is ongoing. Police, fire, and PSAP continue to keep us safe, and public works and waterworks operations are moving forward. We have a virtual city hall at grandforksgov.com/virtual where you can fill out applications, pay utility bills, and apply for permits all in one location. Also, if you or a loved one is arriving from recent travel, please go to grandforksgov.com/COVID travel and take the brief survey, which will give you information on what you can do returning home from one of the locations listed on the page. Additionally, I have a couple of specific administrative updates. I'll be issuing an executive order to waive transit fares for city's area transit and dial-a-ride services. We as an organization are continuing to adapt to these new norms with the health of city staff and the public as the two highest priorities. As such, I'm postponing spring cleanup operations to a later date, still to be confirmed. Sometimes the hardest thing to do is wait. We need to be vigilant and cautious in the weeks to come. We all need to take personal responsibility for keeping our friends, neighbors, and loved ones healthy. Thank you. And with that, I'll turn it over to Dr. Deer from Alto Health System to provide an update. Dr. Deer?
Thank you, John.
Yeah, go ahead, Doctor.
All right, thank you, John. Thank you for the opportunity to again meet today. And I remind the community of resources they can use via altru.org, the North Dakota Department of Health website, the Grand Forks County website, and cdc.gov for all coronavirus information. We're continuing our operations on an hourly and minute-by-minute basis. I like to stress that in all these forums that things I say now may not actually be true 30 minutes from now, a day from now, or a week from now. This is a fluid operation. It's a pandemic that none of us have ever dealt with in our lifetimes. We have made decisions regarding visitors to limit to 1 in the hospital and clinic settings. In the emergency room now, we're down to 0. That does not mean that we won't allow visitors in the appropriate setting. It simply has to have a need for that to affect that patient's care. As of this meeting, as you just heard Dr. Brown say, we have 0 positive tests in Grand Forks County. We have tested 289 total tests through Altru, and as of right now, 41 are still pending. We've heard a lot in the media about supplies and testing equipment. At this time, our current Altru has adequate supplies to continue testing per North Dakota Department of Health guidelines, and we have adequate supplies. That's not to say that we aren't actively managing this and always thinking of the patient and our staff safety as we work through different personal protective equipment. It also gives me an opportunity to thank our community. We've had construction companies, dental offices, many different businesses reach out to us. And it really highlights why we live here and why we enjoy working in a community like we have. We're going to continue to work with those people as they've offered up some personal protective equipment. And I think Deb will touch on a little bit of what's appropriate, what's not in the current time frame. So again, thank you to all, and thank you for this forum, John.
Thank you, Doctor. We will now go to Dr. Brenner for your comments. Hold on, Doctor, while I unmute you. Go ahead, Doctor. Hold on, Dr. Brenner. It is still has you muted. Trying to unmute you. Thank you. Dr. Brenner, go ahead.
Thank you, John, and to everybody watching our Grand Forks community. thank you for this opportunity to share the school district's perspective relative to where we're at with COVID-19 and how we are moving forward. First of all, I just want to say that in times like this, it takes extraordinary leadership from our leadership team. And when I talk about our leadership team, I'm talking about our cabinet level district administrators, our directors, our principals, associate principals, and our teacher leaders at all levels of our organization. People have rolled up their sleeves and have led in phenomenal ways that will well position us moving into the future. And frankly, before I get into where we're at and where we're going, COVID-19 has really just accelerated some of the plans that we had in place over the course of the next 2, 3, 4, or 5 years as it relates to distance learning. We've been moving in the direction of blended learning for a couple of years now, having conversations with students, with teachers, with committees called our District Innovations Committee, our multi-tiered support system academic committee, et cetera. So this is not a new conversation for us. We just didn't have all the infrastructure built to do what we're planning on doing as early as next week. So given the governor's decree a week ago from this past Sunday, put us in an unusual situation, because on Monday and Tuesday, March 20th and 21st, we were scheduled to be in session and then going on hiatus for spring break that Wednesday, Thursday, Friday. Had we been able to be in school Monday and Tuesday, it would have made life so much easier for us with deployment of school supplies, student supplies, technology devices, et cetera. But that was not the case. So it's created some challenges for us as spring break ended, and today is Monday, and we have everybody has been invited back to work following social distancing guidelines at the building level, but also giving people the opportunity, if they have underlying health conditions or they're in a household with somebody who fits that category, or there are childcare, daycare issues, we're being very liberal in allowing people to come back or allowing people to stay away. So to that end, our plan for this week is we've got a majority of our staff back in buildings today and tomorrow. And what they are doing is putting together and packaging, first of all, priority are technology devices for students in grades 3 through 12. And that basically is to position us to instruct using a distance learning model or virtual education. So the plan that we have for K1 and 2 is more paper pencil activity, and those materials will be deployed this week as well. So here's how it's going to roll. On Wednesday of this week, well, let me just frame everything by providing this disclaimer. All parents are going to hear from their school principal sometime today or tomorrow, likely today, but nonetheless, it's going to set the table for how parents and students will be able to pick up school supplies, devices, et cetera. All of this will be done from a curbside perspective. No students, no parents, no people outside of our school community will be allowed in the buildings. So the communication that goes out to parents will identify the day, the date, and the time frame of which parents can swing by curbside to pick up student supplies. And so Wednesday of this week, tentatively, that's scheduled for elementary schools. And it won't be just at one pickup point at our larger elementary schools. They'll probably use more access points than just one, so we don't have a log jam. And that will also be the plan for middle schools on Wednesday. So again, parents will be communicated about this plan. High schools, we've got a larger animal to wrestle there with Central High School and Red River when we're dealing with approximately 1,000 students at each of those sites. We will be ready to deploy technology devices on Thursday of this week, and we'll use Friday as a backup day if some parents and students are not able to pick up their things curbside relative to the doors that will be accessed during those times. So the overall plan then is, according to the governor's decree, by Wednesday of April 1st, we need to have online instruction beginning. We think we're going to be ready before that. We'll have information into the hands of parents and students prior to that. As a matter of fact, as we speak, a number of teachers have already reached out to their classrooms and have started some instruction, which is a little ahead of schedule. That's fine. We know that some students are anxious about getting back into a learning environment. And so with that, we also need to provide a district level distance education plan and submit that to the North Dakota Department of Public Instruction by Friday or on Friday of this week, and we will meet that deadline. So we have a number of people who are working on that plan, from district administration to principals reviewing that. We'll have some teachers put their eyes on that and provide some feedback and input before we do submit that. So probably the one, I think I'll just try to stay ahead of one of the questions that might come up in terms of access and equity when students are learning from home. The question might be, what if people don't have access? We have surveyed all of our families electronically, and we got a pretty good response rate. We know that we have a small percentage of people who don't have access or they don't have technology. And we do have a plan in place to mitigate that as early as Wednesday of this week, whether we're working on setting up hotspots using devices as the hotspot, or if that means we're going to partner with Midco or some other local or distant vendor to help mitigate the access ability from a technology perspective. So that's where we're at. Teachers are continuing to plan. They're planning collaboratively, virtually, or they're planning face-to-face, keeping the social distance expectations guidelines. And we have more detail that will to come, but I hope that this is generally speaking, a good enough framework to let everybody know that taxpayer dollars are being used wisely. And it's incumbent upon us to provide teaching and learning, which is our central mission for students who are now homebound. So John, thank you for this opportunity, and to my colleagues at other sites across the city, thanks for allowing me to weigh in, and I will stick around because I have a feeling there are going to be some questions.
Thank you, Dr. Brenner. And along those lines, I'm going to keep your screen up. I now open it up to any questions from the media as I'm monitoring here on the computer as far as raised hand. I see a raised hand here from KNOX. Go ahead, KNOX.
Dr. Brenner, Ryan Cunningham this afternoon. Can you give me an idea of what type of guidance you're giving your education staff at this point about what distance learning looks like as far as a time frame? We know what the situation is with the governor waiving days up through March 31st. Distance learning is supposed to start April 1. Is there any conversation at all going on amongst the school staff right now that we're doing this for X amount of weeks, X amount of days? Is the conversation be ready to do this through the end of the year? Your thoughts on that?
Yeah, and I don't want to project the unknown, but we are certainly positioning ourselves to do this over the long haul. We'd rather over prepare and over plan, and then if we're back in the buildings in a few weeks, good for us. We will have simply set a standard for some additional learning opportunities. But in the case that this does move out over the course of weeks or months, then there will be some very tight guidelines for teachers to follow relative to office hours, like professors do at the university level, and also instructional hours. So there's going to have to be some really intentional coordinating and planning at the building level. For example, high school, I'll just use that as an example. If we have a math instructor and we've got an English instructor and a social studies instructor, we want to make sure that their instructional times are coordinated so there's not overlapping of content. So a student doesn't get caught where he or she needs to be in two classes at the same time. So other means to mitigate that type of schedule will be teachers uploading pre-recorded learning opportunities. So there are probably going to be some asynchronous opportunities for students, and then there are going to be some synchronous times as well. It's a little more complicated at the high school level, less complicated in middle school. And in elementary, when we have one teacher essentially responsible for a classroom of students, that teacher can certainly do the pacing of content standards and instructional delivery.
Thank you, Doctor. The next question is from Mr. Joe Bowen.
Hello?
Joe, go ahead.
Yeah, hey, first things first, sorry for using a curse word on the stream, did not know we were live. And then second thing, it's a question for Terry. You said you're pushing up the table for blended learning. What's taking a back seat then, if you're accelerating that plan?
Well, nothing is taking a back seat. Blended learning is simply a concept that our students are telling us, particularly at the high school and middle school level, that they want to have a variety. They want to have a smorgasbord of learning opportunities. And what we know about all students is one size does not fit all. So the notion of sit and get type of instruction, that's a thing of the past. And if we want to really differentiate for all of our learners, accelerate kids where they need to accelerate, allow kids to be passionate about what they want to learn about, and develop some courses clustered around those kinds of concepts, that's what we really ought to do. So our high school students are telling us, the type of environment they want to learn in is more of a cafe feel. Our schools aren't built around a cafe feel, so but even given the structure of our buildings, we can still create those kind of environments. And I think this will be an opportunity where some kids will really accelerate, and some students who need some remediation will also benefit from a blended learning model as well. So when I say blended learning, that's usually when we still have the face-to-face options. Right now, we don't have that opportunity. So when we're back in the schoolhouse, we will simply have accelerated that plan, likely moving it up, like I indicated earlier, by 2, 3, or 4 years.
Thank you, Doctor. A question from Mr. Bowen from the Grand Forks Herald.
Yeah, hey, so just to clarify then, there's no opportunity cost whatsoever for moving that 2, 3, 4 years worth of planning up to right now?
I'm sorry, did you say no cost?
No opportunity cost. Like if you're moving 2, 3, 4, however many years worth of plans up to basically now, nothing is getting put aside for that? You're not backburnering anything then?
No.
I mean, I don't see how that's possible. Like if we're planning to do it over several years and now it's all right now, how are you doing that without something else suddenly needing to get put in that 3 to 5 year timetable, or a couple of things?
Well, as a former director of curriculum instruction and teaching and learning, what I used to say is, if we could just keep kids away for a few months, we could really put together a robust plan in place for teaching and learning. But that's not the case. This has really created an opportunity for us to do some planning while students are away from us. It's just really ramped up and accelerated. We've done a count of our technology devices. We have enough for each student, grades 3 through 12. We'll probably even have enough to drop down to grade 2. But what I also want to say in this conversation is we want to be really aware and cognizant of screen time. This can't be about 8 hours of looking at a screen. We want to be really intentional about providing opportunities that doesn't just link a student into screen time.
Okay, another question here from Mr. Bowen. Go ahead, Joe.
Yeah, hi. You said there was a mitigation plan for students without access, might have a hard time doing online learning. What does that look like specifically? Like if I have a hard time getting on the internet or whatever, what am I doing to keep learning at one of your schools?
We're working with a couple of companies right now and that was really talking about accessing technology. If we've got some families who don't have internet capabilities at home, we should have that resolved by Wednesday, or at least a final decision by Wednesday of this week. And it's probably going to take a few more days to get people hooked up online who are not presently hooked up. There's a little bit of a waiting period with Midco. It's not bad. It's about 5 days. So if we can provide some hotspots through a device, and by the way, the whole concept of hotspots, they're on back order nationwide. Globally, they're on back order, but we think we've got another way to mitigate that without getting into details, because I'll get ahead of some people regarding that kind of a plan. But I do want to say that we've got all hands on deck and making sure that everybody does have access when we are ready to go on Wednesday, April 1st.
Again, Mr. Joe Bowen. Go ahead.
Hello again. So to clarify, the plan is to have the kids who don't have internet access or ready internet access, the plan is to give them a hotspot of some variety so they can do the same learning as everybody else?
Yes.
Any other questions out there from the media? That was thank you, Dr. Brenner. We kind of knew you'd be on the hotspot here with this one. Mr. Joe Bowen again.
Hello again. Yeah, I got a whole bunch, and we are indeed okay with me going through the whole list this time. Last time I was shy.
Oh, you came up short last time. I apologize, Joe. We'll get through it.
All right. So this is the first community sort of question. What's happening to things already paid for, such as picture days that were canceled?
It's a good question. That hasn't
Thanks.
come up yet. I would venture to guess that there are probably going to be some refunds if we don't follow through with some of the things that have been paid for. We have had conversations about, we've got Valley Middle School students, 7th graders going to Wolfridge. They've been fundraising for 2 years and that bill has been paid. It's likely that they won't be going to Wolfridge because school won't be in session. So we're going to have to work through all of those situations on a case-by-case, or I shouldn't say not a family case-by-case, but on an event, a case-by-case scenario, and see how we can provide reimbursement for that.
Thank you, Doctor. Joe?
Yes. All right. If you guys do end up going online for the,
Oh, I apologize, Joe. Sorry about that.
yes, how dare you? So if you guys do end up going online for the entirety of the year, how will you accommodate special ed kids who have IEPs that might say maybe they can't do that?
We have our special ed executive director and assistant director working directly with the North Dakota Department of Public Instruction Special Education Department, along with directors from across the state, discussing adaptations and modifications. There really are a couple of different tracks, and we haven't made any final decisions. Our goal is to educate students who are on IEPs because out of our 7,500 students, we had about 1,000 at varying levels of needing some support. We're working through that right now. We don't have a complete answer, but we should have a complete answer by Friday of this week. It would be our goal to provide those accommodations, modifications, adaptations for students while they're in the home setting, knowing fully well that some students simply need one-to-one adult support. So stay tuned on that one, Joe.
Okay, we have a hand raised here. Excuse me, Joe. We have a hand raised here from KNOX. Go ahead, KNOX.
Dr. Brenner, going about making sure that students can make the progress that they need to make. Obviously, there are some students that will struggle to try to put together the final push that they need to graduate from high school, that type of thing. You don't have the one-on-one opportunity in the classroom right now. You're hoping to create that, but is there going to be some kind of a way that students that may struggle to accomplish the final classwork, will they have an opportunity this summer? How will they go about making sure that they can graduate with their peers versus this type of a setback, making them having to come back in the fall or to repeat a grade?
Yeah, we're talking about grading practices right now because we traditionally at the middle and high school level, but I think Ryan, what you're talking about is probably talking about seniors in graduating. We typically have the GPA, the 4-point scale, et cetera. We're talking about maybe lifting that. We haven't made any final decisions. We're talking about SU type of grading or pass-fail grading. It's our goal, and you're going to hear me say this on more than one occasion, it's our job to make sure that nobody fails. And instructors who will have office hours will be able to provide that one-to-one support for students. And we'll also look at how we can utilize some ancillary staff who may have a different type of schedule as we move forward. We haven't spoken directly to all of the other content areas who may not be considered core, but we will want to visit with some people about how they can provide some supportive services that even though it might be outside their content area, they can still provide support in more of a tutoring manner than not. So we still have some of those details to work out.
And Mr. Bowen, go ahead.
Yeah, hey there. So what's the plan for like hourly or part-time employees of the district? Paraprofessionals, lunchroom workers, bus drivers. Are they still going to get paid even if you guys move to virtual learning, distance learning?
Yeah, right now, through the governor's decree through March 31st, everybody is being kept whole. Everybody is on payroll. And we have a school board meeting tonight, and there's going to be a resolution that the board will read and either pass or fail that resolution. And that is simply to keep all of our hourly people who normally work at the building level, paraprofessionals, to your point, Joe, to keep them paid for the rest of the school year. A lot of other school districts are doing that as well. And, the last thing we want to do is lose some people to other employment. So in the event that when we are back in school, those are people we don't want to lose. Again, that'll be a school board decision, school board conversation this evening.
Joe, you said you had a list.
I do have a list. All right. I think I got all the school ones. I apologize if I missed one. This is more of a healthcare question. How many test kits does All True have?
Dr. Deere.
Yeah. Well, I can't speak to the specifics as to how many tests we have. We do have an adequate supply of tests for our current state, and we continue to follow the North Dakota Department of Health guidelines as to who we should be testing. That said, from our COVID hotline, we're screening a lot of patients, and our test number continues to be varying day by day.
Okay, KNOX, you have your hand in the air. Go ahead.
Dr. Deere, question on the healthcare perspective. We're hearing more and more nationally about some medications that have at least some evidence to them being helpful in treating people that contract COVID-19. One of them, I believe, is pronounced hydroxychloroquine. It's an anti-malarial drug. There are some other medications like that out there. If you did have a case of COVID-19 and someone wanted to try those medications, would there be a path for somebody at All True to be able to procure those medications, or is that a bit beyond our reach?
Yeah, so we are currently discussing our inpatient protocols for when and if we have a patient with COVID-19. The hydroxychloroquine, as you said quite well, is actually only been used in the inpatient setting. And there was a little bit of information that went around the internet and other media outlets that it could be used for prophylaxis, which if it ever panned out, that'd be great. But there are no studies saying that that is actually fact. So Dr. Fauci spoke to that quite a bit over the weekend in the national media. And there are other treatment options that show a little bit of promise, but majority of treatment right now is just symptom management and supportive therapies.
Thank you, Doctor. Mr. Bowen?
Hey, so to clarify, is there a way that you could come back the next time we have one of these, because presumably there will be next time, with a specific number of testing kits? Say, like from a point in time, like maybe we had X number at the beginning of the day today, and we've used Y of them. Is that something you can do?
No, I don't think we're ready to do that. I think the community just needs to understand that there's a national shortage, that this isn't an All True necessarily supply chain problem, and that we have adequate tests right now to support the future inpatient capacity and the outpatient testing capabilities that we want to continue to support in our community.
Kate, Mr. Bowen, go ahead.
So to clarify, you don't have a number, but we can all rest assured that it's enough?
Accurate.
Any other questions out there from the media or panels out there? Yes, Mr. Bowen.
Okay, what's the criteria for getting tested as opposed to just getting screened? Like, how do I go from a screening to getting tested?
Yeah, so good question. We've had over 1,800 phone calls since we started tracking, and I'm not sure if we started tracking right away. That said, we've done 289 tests where actually patients were screened in and the test was physically performed on them. We are following North Dakota Department of Health guidelines, as I've said many times. That would include being in contact with someone with COVID, which is not a real high population here, given the fact that we have no cases right now in Grand Forks County. Also, we're testing those who have traveled and who have symptoms. So if you came from an endemic area with community spread and you have symptoms, we're screening you still. So we're still doing curbside testing. And then there's other categories for healthcare workers.
Okay. Any other questions out there? KNOX, you have your hand in the air.
Yeah, question for Mayor Brown and for the staff at the city. So earlier today, a question was asked regarding whether or not we would have enough workers in our public works to deal with potential flooding that would take place, along with the regular things that public works needs to take care of, should some of them come down with COVID-19. So can you talk to us about the staff that you have available and whatever plan you may have to make sure you rotate through people so that if the 2-on-1 whammy were to hit at the same time, you'd be fully staffed and be able to handle day to day along with fighting a flood.
Am I unmuted, John?
Yes, you are. Go ahead, Mayor.
Yeah, that's why we're doing the minimum necessary crews presently, and that's why we're using social distancing with workforces and staggering crews so that we don't have that problem, so that we keep an adequate workforce in place when that does happen, because it will happen. So that's what we're planning for presently, and that's why we're being very strict with our social distancing and shift divisions and workforce.
Thank you, Mayor. And also on the line, we do have Mr. Todd Phelan. Mr. Phelan, would you like to comment on this one as well? Go ahead, Todd.
I think too, what the mayor just spoke of, yeah. You know, if the public could realize that we have 12 flood stations, and those are going to be activated in and around the 40-foot mark. So those crews are working on those right as we speak. And then the street crews and public works, they work on the stop logs. So some of those measures we're going to get out of the way as soon as possible. And then it's really more of a monitoring situation as we work through those different systems. So the public should know that we have plenty of staff. We're going to try to get as much out of the way as possible. And then the important piece is really to monitor our flood protection system like we do any other infrastructure system.
Thank you, Todd. Hang on there, Todd. Mr. Bowen, you have your hand in the air.
Yeah, sorry, I've been doing about 3 things at once, so I apologize if I already addressed this. Do Ultra employees have to self-quarantine after they've been traveling?
I'm deferring to Dr. Deere on this one.
Yes, so if they meet criteria for need, they do self-quarantine.
Okay, and Mr. Bowen, your hand is in the air again.
Yeah. What is the criteria exactly?
So the criteria for health workers is changing on a daily basis. And you'll probably be seeing with guidelines coming out later today that it's going to be different in a few hours than it is now. So obviously, if you're symptomatic and you traveled, you're going to be self-quarantined, but it's a case-by-case process that our occupational health department is carrying out.
Okay, and Mr. Bowen?
I understand if it's going to change in a minute, but what's the criteria right now?
Dr. Deere.
Yeah, so currently it's quarantined for 14 days, as I said, with symptoms, travel to a level 3 country, cruise ship, other things, with ongoing wide transmission, quarantine for 14 days, close contact, 14 days. And then if, yeah, that's what it is currently. There will be other changes that are going to be coming out.
Thank you, Doctor. And Mr. Bowen, with your hand in the air again.
Yes, hello again. So this is maybe more of a question for Mike or Todd here, but it looks like public health released, but then maybe quickly deleted a graphic that says any travel by airline and any international travel recommended to quarantine for 14 days and monitor symptoms. And then they deleted it, looks like, and maybe asked people to do a survey. I'm not really clear. Can you guys say what's going on there?
I actually can answer that one real quick there, Joe. That is, and hang on there, Dr. Deere, as I have you on camera.
Oh, and I apologize. I didn't know Debbie was on this call. My bad. So,
yeah, and Deb, you're on the call as well. Deb, I'm gonna, if you're okay, I'm gonna answer it real quick, and then Deb, you could jump in. There is a survey for travel. It is on the North Dakota Department of Health website. It is on the Grand Forks Public Health website. It really depends on where you've traveled to, and it gives you guidance and whether you need to self-isolate or not. Deb, as I have you on here, trying to get you unmuted. Go ahead, Deb, to answer that one as well.
Yes, we do expect that the guidance relative to healthcare workers may change specific to travel. And that's related to the fact that we now have some widespread cases occurring in other parts of our country. So I would say stay tuned to all of the websites, North Dakota Department of Health, Grand Forks Public Health Department, as we get that updated guidance and put it on all of our websites as well as All True. We do have a travel survey still on our website. These are for any people who are traveling. They can complete that. It will allow them to get guidance as to whether the areas that they have traveled to will be areas of risk. But as Dr. Deere mentioned, we do expect for healthcare workers that there will be some additional guidance relative to screening. If I could, I would like to also just address one other topic that hasn't been mentioned today, and that is the overwhelming support of the community for providing personal protective equipment like masks. And while we appreciate everyone's willingness to pitch in and make handmade masks, we're not able to accept them right now or manage an inventory of that. Homemade masks are not recommended for healthcare workers. They don't have the necessary personal protection. Masks are meant to be disposed of, not used over and over again, and they can actually have some detrimental effects for spreading disease. So while we appreciate everyone's interest and concern, and they can still make them, it's just that as healthcare agencies, we're not able to accept them right now. We do, however, appreciate places like dental offices, schools of nursing, or healthcare organizations that want to donate approved protection. We would greatly appreciate those donations. Thank you.
Thank you, Deb. Joe, your hand is in the air. Go ahead, Joe.
Yeah, thank you, by the way, for preempting what would be my next question after this one about homemade masks. But the whole reason I was asking about that graphic is someone wanted to know, the graphic says travel by airline and international travel, and they want to know if they should do anything if they have traveled domestically by train or bus.
I'm looking to Deb Swanson on this one, if you may, for the guidance, or maybe it is Dr. Deere as well. Deb, can you jump on this one real quick?
I'm not aware that we have any guidance specific to other methods of transportation besides airlines at this time. That's not to say that it couldn't change, though, as we get additional cases. We just really want to promote the importance of not traveling unless it's absolutely necessary, because we know that that can be a major spread of the disease from other parts of the country to our community. So we appreciate everyone's cooperation there.
Dr. Deere, is anything to add from Ultra's standpoint? I'm assuming you're following the same guidance.
Yeah, we're following the same. We haven't heard anything specific on those recommendations.
Thank you, Doctor. Joe, how are we doing on your list? We're getting up to the 3 o'clock hour. How are we doing?
About halfway done. All right, so some of these are a little close to repeats here, but at what point does North Dakota put us in a shelter-in-place order? Like what would need to happen first? I know we kind of asked this one again, but maybe something's different now.
Boy, as I'm looking across from a local level, from the state of North Dakota, it would have to be a guidance from the governor to do something like that. I'm looking at Mayor Brown or Mr. Phelan. Do you have anything to add on that one at all, as I see them shaking their heads? That would be guidance from the governor, Joe.
Okay.
Go ahead, Joe. Go ahead.
Oh, sorry. Am I just permanently not muted?
I just missed you on that question.
Oh, okay. All right. So the other one is home might not be a safe place for people. You know, like if you have to home quarantine, but maybe you're in an abusive relationship, that sounds like. What sort of options are there for people who maybe need to self-quarantine, but maybe it's not safe for them to do it where they would be self-quarantining?
To this is I'm looking to Deb Swanson again. Deb, would you be able to jump in on this one, please, and talk about some options there? Thank you, Deb.
Yes, the Grand Forks Public Health Department is working on this right now as we speak. But in order for us to secure the proper place where that can be carried out, there are some requirements that would make us have to do some type of a procurement process. We are in the process of working on that, though. I will say that, not specifically for the situation that you mentioned, but we know that there are people who do not have a permanent residence in our community, and being in a congregate setting would not be appropriate in this situation. So we are working with our city attorney and our health officer to determine locations and possibilities for this, and we hope to have something available for the public this week. Thank you.
Thank you, Deb. And to this point, Joe, before I get to your question, we are running up against the 3 o'clock hour. There's another meeting at 3 with businesses. So Joe, I know you have a list. two more questions, then maybe you can email me that list and we can answer them through a social media conversation. We can do that. But Joe, go ahead now.
All right. Well, all right. Public transit. What are you guys doing there? My understanding is fares have been eliminated and people going through the back door of the bus. Is that the case? And if so, do you anticipate any future steps there?
Mr. Phelan, I'm going to go to you first on this one. Go ahead, Todd. Go ahead. Oh, Todd, you're muted.
Thank you, John. Can you
There
hear
you
me
go.
now?
Yes.
Joe, you are correct. I think until early April, we have eliminated fares both for city bus and paratransit. There was such close integration with the passenger and the customer. We decided it was the best measure to not have the fares and the exchanging of a fare with the bus driver. Also using the back door of the bus so that we can have that person that's entering the bus or the paratransit vehicle as far as possible from the operator.
Okay, and then what would need to happen for city transit to just shut down? Like what would trigger that?
I think a similar sheltering in place where there's no travel advised. People are to shelter in place and not go anywhere other than an emergency. It'd have to be something like that. We are still transporting people that need to get to grocery stores and other needed places of business.
Mr. Bowen, one more, okay?
All right, yeah, I was about to say that was a question of follow-up. That counts as one. All right, are there what sort of numbers or indicators would you guys be looking for that might signify we're on the other end of this? Like before things might start returning back to normal, basically.
I understand that, and I'm looking to our healthcare, whether it's Dr. Deere or Deb Swanson on this one. Can we start with Deb, please?
We don't have exact guidance for the United States yet, but we're looking to other countries and things that have worked in other countries. And generally, it's no new cases and also no new community spread. Community spread is really our harbinger for knowing what's going on in our community in terms of people who are spreading to other people who might be asymptomatic. So we can expect that that will be an extremely fluid situation. The guidance will vary depending upon communities and states. But what we do know is we have some experience from other countries, and the countries that have been more aggressive in their social distancing endeavors have been the most successful.
Thank you, Deb. Dr. Deere, would you like to add anything to that as well?
Yeah, I think that we're preparing for community spread. And if that doesn't happen, I think all of us on this panel and everyone in our community are going to be very thankful that we don't have it. But that's what we're preparing for. So I think we are still in the starting blocks, so to speak, of the initial COVID outbreak.
Thank you, Dr. Deere. Thank you for everyone joining us here. Mayor Brown, I'm looking to you to maybe you gave the opening statement and maybe giving the ending statement on this one, please.
The ending statement remains the same. Stay home, watch Netflix, and save lives.
Thank you, Mayor. Thank you, everyone who joined us here on Facebook and on Channel 2. Dr. Brenner, Dr. Deere, thank you very much for joining us here. And thank you to the media for your questions. And stay safe out there. Stay home. Support local business the best you can. If you're not feeling well, stay home. And Mayor, I know you've got to hop off to another meeting now. So thank you very much, everyone.